Welcome to the first lecture about care of a child who has a renal or genitourinary problem. This is the first of 5 parts. We'll begin with a review of the renal system. It consists of an upper as well as a lower tract, all of which can develop problems related to congenital anomalies, mechanical flow issues, as well as infections. The most frequent disorder of the renal system involving children is urinary tract infection. A lower tract infection involves the urethra or bladder and is usually in the form of urethritis or cystitis. The upper tract involves the parenchyma of the kidney itself and is called pyelonephritis. Assessment for GU disorders includes all of the bullet points listed in this slide. Considering that infection is the most common, of course we're going to assess for a fever at the current time as well as in the recent history. The fever is one of the most common indicators to the parents that something is wrong. Remember, the younger the child, the greater the likelihood of a complication due to something as simple as urinary tract infections. And this is especially an important point to remember when you're talking about neonates and infants. In regards to the fever, you want to know how high, for how long have they had it, what antipyretics have been given, and when was the last dose. You also want to include, as with any kind of an evaluation, what was the child's response to the treatment measures. Behavior is very important. Is the child eating normally? Another key point when we're dealing with neonates and infants. Is the child sleeping more or less? What is their overall behavior like? Because the younger the child, behavior is the way an illness will manifest itself. Keep remembering that key point. Is the baby or child playing as expected? We must assess for swelling. And as we get into the variety of conditions, we want to find out where is the swelling. Is it periorbital? Is it the lower extremities? Is it overall edema? And where did it start? Do we have a new onset of enuresis, which is bedwetting? So of course this would apply to a child who has previously been toilet trained. When they have a urinary tract infection, oftentimes because of the dysuria, they can't hold their urine. We also want to look at nausea, vomiting, and diarrhea, anorexia, which goes along with appetite changes. Now, when you look at these symptoms, this can apply to any disorder, not just related to the renal and GU system. But in this system, we are particularly worried about development of hemolytic uremic syndrome, which has a set of slides in and of itself. We will find out, is there a family history of renal disease? Because some things do occur in families. When assessing for pain, we need to find out, when do they have pain? Is the pain only present with urination? Do they have back or bladder discomfort? Do they have groin pain? Because this can indicate something like testicular torsion, which is an acute onset and it's severe pain affecting the scrotum. They may or may not have erythema and swelling. And of course, because this is the private parts, males are very reluctant to share this information, so you have to ask and you have to look. In addition, is the urine stream as strong and steady as it usually is, or is the child going to the bathroom frequently and it's only dribbling? An important assessment factor is back pain. Do they have what we call CVA tenderness? And that stands for costovertebral angle. because this is indicative of a pyelonephritis, and pyelonephritis is considered to be a complicated urinary tract infection, not just in children. Continuing on with assessment for GU disorders, in addition to fever, is there an elevation of the blood pressure? Because if there is, most likely this is renal in nature. You want to palpate the abdomen for an enlarged bladder. Sometimes, believe it or not, we can palpate a kidney because they have a very large mass. We'll talk about that when we get into cancers in children. Do they have tenderness with palpation? Do they have what we call organomegaly? And once again, this would be a renal tumor, and we call that the Wilms tumor. Infants who have recurring urinary tract infections may have failure to thrive. So once again, assess for CVA tenderness. So you put your hand in a fist, and you want to put your thumb underneath your fingers so that the first finger and the thumb, when it's closed, has a flat surface, and you gently tap the costovertebral angle, which is going to be the spine and the last rib, and you just go 1, 2, 3. If it's really tender, they will definitely react to it. What labs do you think are going to be important for genitourinary disorders? We're going to talk about a lot of them as we continue on, but be thinking about this because you have already had this information. When we examine the genitalia, look for swelling, redness, or irritation. We want to note, are the testicles descended? We want to note if the foreskin on the penis can be retracted. And we also want to look at the anatomy. Does it look normal for a female and male? And we'll talk about some disorders later on. I've listed common nursing diagnoses that are appropriate for the renal and genital tract system. So I would recommend that you keep a copy of this so that when you're making your care plans, you can utilize them. Now here are what I call the reiterated questions that you have been getting from first semester, and you will hear them all the way through fourth semester. And you should keep these questions in mind whenever you are in practice, because it can be disease or complaint specific. What do you expect this patient to look like when you walk into the room based on the history that you have received, the report you've received, and considering the diagnosis? What are the important assessments to make? What are the complications that can occur that you should be on alert for? What will the complications look like on the patient? What can you do to prevent complications? And what should you do if a complication occurs? What patient education is needed while inpatient, at the time of discharge, or in the outpatient setting? You will be accountable. You will be held accountable for all of these questions on your exams, as well as in your care plans and in discussions with your clinical professor. This ends part 1. Move on to part 2.